Speaking of Dr. Cigarroa, thank you so much, Francisco, for being here today. He is currently director of the Adult and Pediatric Liver Transplantation Divisions at the University of Texas Health Science Center at San Antonio. But it was during his tenure as our chancellor from 2009 to 2015 that he helped lead us to an era of revitalization from Hurricane Ike's destruction. He always provided wise counsel, reassurance, thinking about how we could move forward as we considered recovery plans, and he very much advocated for those plans throughout his term as chancellor. Perhaps even more importantly in the minds of many of us who were here, he visited our Galveston campus in the very early days of his administration. I think he'll probably tell you that he was actually advised not to do that by some of his advisors because it was controversial at the time about whether or not we would be downsized. But he felt it was very important to be present on the campus to show a vote of confidence and indicate to all of us that he was behind us and was going to do whatever he could do to help us not only move forward, but to thrive over the course of time. So Francisco, we're so happy that you're here with us today. Please join me in welcoming Dr. Francisco Cigarroa.
Well, David, thank you very much for those very kind remarks. I'm really extremely grateful for you to have invited me to be a part of this incredible celebration of the opening of the Jenny Seeley Hospital. And David, I could not be prouder of your leadership and that of UTMB's faculty, staff, administration, and students. I'm also extremely proud of our Texas legislature, Paul, our Board of Regents, of the Seeley and Smith Foundation, and the thousands of alumni and the thousands of supporters who have made today possible and positioned the UT Medical Branch to be among our nation's greatest comprehensive academic health centers. Galveston, as we all know, is a very special city in our world, but it's also very rich in medical history. If you actually look at the Handbook of Texas, it tells us that even before UTMB opened its doors in 1891, the physicians of Galveston already had organized medical societies, taught medical students in 2 colleges, examined candidates for licensure in Galveston County, treated indigent patients at local hospitals, and edited the state's only 3 medical journals. And also, importantly, Aspel Smith, the president of the UT First Board of Regents, was a practicing physician here in Galveston, and he's fondly recognized as the father of the University of Texas and the father of Texas medicine. So Texas benefited from the vision and the wisdom of Aspel Smith and many responsible legislators who foresaw the need for universities and medical schools to educate the future leaders of our state. And so in 1881, the Texas voters chose Austin for the site of the main university and Galveston for the location of its medical department. So when UTMB opened its doors in 1891, there were 13 faculty and 23 students. No one could have ever imagined the future magnificence of UTMB and how it has changed the world and how it has impacted clinical care, education, and research. Certainly, they could not have imagined today. So in a historical context, we all know we can't talk about the city of Galveston without talking about hurricanes and their destructive toll. So despite the overwhelming devastation of the 1900 storm, the deadliest hurricane in U.S. history, this young UT Medical Branch persevered. Old Red, as we all know, was damaged significantly and needed either demolition or massive reconstruction. So 4 days after the hurricane, as we all know, UT Regent Beauregard Bryan, who was the chairman of the Board of Regents Medical Committee, sent a telegram to President Prather that contained a single sentence: the University of Texas stops for no storm. Well, the Regents appropriated the funding to restore the medical school in 1900, and the first chairman of the Department of Surgery in the University of Texas, his name was James E. Thompson, wrote, "The Regents were so generous in repairing the damage to the building and restoring the equipment that we were actually in better shape than we had been before. And the pathology professor, Alan Smith, added eloquently, like a phoenix rising from its fire, the institution has risen from its wreckage. Well, over the next century, there would be more hurricanes and more destruction, but perhaps none worse than Hurricane Ike in 2008, which hit Galveston on September the 13th. As David stated, I assumed the chancellorship of the University of Texas 4 months later, and many observers were already conveying that the medical branch could not rise from the wreckage this time and should shut its doors and move off the island. I very clearly recall being in San Antonio one weekend on the surgical call when Dr. James Hadnot, a senior obstetrician and one of the very first Black physicians that graduated from UTMB, urged me with a tear in his eyes that UTMB had to survive, and please, Chancellor, do everything in your power to revive UTMB and prove those skeptics wrong. Well, I told him, it was a very powerful moment, I told him I would do my part, as I had a clear vision that UTMB not only had to survive, but had to thrive. So with the support of the UT Board of Regents and the Texas legislature, the federal government, and our philanthropic community, UT System assembled a task force that created an excellent plan for the medical branch. I will never forget, as Craig has stated, the town hall meeting that the Board of Regents hosted on Galveston Island to learn from UTMB's faculty and Galveston's leaders. I can still hear, as if it was yesterday, Dr. Joan Richardson, I don't know if she's here or not, but one of our most nation's revered neonatologists, I can still hear her powerful statement about the importance of UTMB to the future of Texas and our nation, and the need to assure that the National Institutes of Health know that UTMB was still standing and doing research. Because at that time, they felt, well, why should we give NIH grants to UTMB since it's going to close? So one could absolutely palpate the anxiety on that day, but not from President Callender. I've never met a leader as calm, as focused, and as unyielding in his vision as David Callender. His courage and his perseverance were amazing, and his leadership continues in this vein today. He wisely decided that this institution is too important to the people of Texas, and he and his faculty, staff, and students rolled up their sleeves and gave life support to UTMB at a critical juncture in its history, similar to how UTMB has given life support to so many patients throughout its history. Well, as a fellow Texan and as fellow Texans, we owe President Callender our gratitude and our heartfelt thanks that must last throughout our lifetime. I also have to personally thank the Seeley and Smith Foundation for their inspiring philanthropy towards UTMB's history and recovery. No one deserves a Santa Rita Award more than the Seeley and Smith Foundation, and I was so pleased that this year, Paul Foster, through his chairmanship and the rest of the regents, conveyed the Santa Rita Award to the Seeley and Smith Foundation. I'm also exceedingly grateful to Representative Craig Island, who was simply a genius in assuring the necessary state of preparations towards UTMB's recovery and future. Well, in my role as a transplant surgeon, I'm going to convey to you, Craig, the UT Genius and Master Chess Player Award, because it required sheer genius to get all this working. So I remember Craig just working 24/7 on behalf of UTMB, and I recall several conversations after midnight with Craig to get this done. Well, the opening ceremony at the Jenny City Hospital today is the pinnacle, I believe, of UTMB's recovery. The hospital is going to bring thousands of lives into our world through its world-class obstetrics and gynecology department, and save thousands of lives in the years and decades ahead through the healing hands of its physicians, its nurses, and its healthcare providers. This hospital will also educate future physicians and healthcare experts and be a center point of improving the human condition through the powerful clinical research that will occur here. It is also going to help recruit outstanding physicians and other faculty such as Jeff Fair, who recently arrived from Florida to lead UTMB's Transplant Center to assure that UT Medical Branch remains a leader in the vanguard of excellence in caring for patients. If I were a medical student today, I would want to come to UT Medical Branch. So I have never seen UTMB more vibrant than it is today. I give a standing ovation to David Calendar and every UTMB employee and student for all that you have and will continue to accomplish. I am absolutely certain that James E. Thompson is again saying that through the Board of Regents, the legislature, the Seeley and Smith Foundation, and thousands of donors, alumni, and supporters, UTMB is in better shape than we've ever been before. David, thank you.
Thank you, Dr. Cigarroa. You described that team effort. That's one of the things, I guess probably the most important thing that we're celebrating today. Everybody in this room played a role. We all came together, everybody bringing their own perspectives and their skills and their contacts, ability to influence others, and made the case for this to happen today. But thank you for your leadership in helping drive that forward.
UTMB Health, working together to work wonders.